Yeah, thanks also again from my side for the presentation and the project. We're looking forward to it. And now I'm happy to have be able to announce Andreas Hochhaus. So we reserved the best for the last, more or less, who is going to talk to us about the future of CML in Harmony Plus. And I think you all know Andreas Hochhaus very well, who is the medical director of the University Hospital in Jena and yeah, one of the CML experts in Europe. Andreas, the stage is yours.
Thank you very much for these nice words, and thank you all for including CML, for having the chance to include CML into Harmony Plus. We are very happy to participate, and I want to show you on a few examples what we are able to contribute here and what we did in the past. And we were not included in the initial Harmony because we had a good and a well-functioning network in the context of ELN and the work package 4 in ELN. And as you know, of course, BCR-ABL is the hallmark of CML, and therefore we want to be a little bit separated from the BCR-ABL negative MPNs because the questions may be different here, and it's good to have two columns here for CML and for MPN. And we know that during the course of the disease, genetically defined subclones evolve. We see BCR-ABL reactivation, that means BCR-ABL mutations, for instance, but we see also BCR-ABL independent resistance. And this BCR-ABL independent resistance is, of course, a target for next generation sequencing studies to demonstrate how these different subclones in the course of CML, dependent on treatment response, but maybe also independent of treatment response, evolve. Since BCR-ABL positive stem cells persist, we know that in all patients, even in the patients who are MRD negative by very sensitive PCR strategies, RT-PCR strategies, they persist and due to BCR-ABL independent signals, we know examples from BCL2 activation. We know studies now from BTK activations. That means it's a very interesting field. BCR-ABL independent pathways which drive or which keep these stem cells alive, and maybe a good target for combination treatments to achieve treatment-free remission, stable treatment-free remission, these patients. Therefore, I think the current approach is to establish NGS strategies which may reveal the hierarchy of these genomic events which are responsive for persistence and resistance, which are two different aspects of CML treatment. And we aim to use clinical data and collect additional molecular data to address these questions of resistance and treatment-free remission optimization. So, and what we did in the past was a big study, a big collection of patient data, and Markus Fürmann and Michael Lausecker, who were not able to make it today, asked me to present their data here from the UTOS collaboration. The UTOS was a private-public partnership with Novartis within the European Leukemia Net, and we had three sections here. We had a section for patients, and we collected the data from these patients in prospective controlled clinical trials. We had an out-study section and a separate population-based section with very well-defined areas in Europe. We did a prospective collection of data in 20 European countries here. In total, we have a database on 6,602 patients with treatment data and with clinical response data. So, and a few examples what Markus and Michael did with this data. First is to establish the UTOS score. The UTOS score was established to demonstrate or to because the tyrosine kinase inhibitors have a different impact on the prognosis of patients, and therefore it was important to establish after Sokal and Hasford a new score. And the problem was with this score that the main endpoint, namely survival, was not available in the beginning because only a few patients died in CML. And therefore, we used the achievement of complete cytogenetic remission here, and we established a score, a very simple score, out of basophils and spleen size to demonstrate the chance to achieve a complete cytogenetic remission within 18 months. These are the curves here. You see the separation of the complete cytogenetic remission rate after 18 months, left for progression-free survival, and on the right on the cumulative incidence of complete cytogenetic remission, and you see the clear separation. And this has been validated. Next slide. On a this has been validated in an independent course, but then later we were able, with more data, with more clinical data available, that means more patients have died and we knew the cause of death, and we were in particular interested in the patients who died from CML. Of course, not from other diseases, from older age and whatever. We're interested specifically on the CML as a cause of death. And this enabled us to calculate a new score now with 4 parameters: age, spleen size, blasts, and platelet count. And this score has now the endpoint of CML-specific survival. You see the separation here. Of course, the risk of death is low. Therefore, the curves are very low on the bottom, but there is a statistically significant separation of low, intermediate, and high-risk patients in the learning sample and also in the validation sample. And then, in addition, we have a new blast crisis registry. Blast crisis is still an important problem in CML. We know that additional genetic aberrations, so-called ACAs, additional cytogenetic aberrations of high risk, herald blast crisis. Therefore, it's important to connect the next generation sequencing data with the blast crisis appearance. And we started with the blast crisis registry. Now we have currently 97 patients from 7 European countries in this registry. And we have, of course, new prospective studies from the work package 4 in the European Leukemia Net from all participants. As examples, I show you here two, the Tiger trial in Germany and the Fascination trial. These are 2 prospective trials which are recruiting or have recruited and are available for a database. And of course, there are trials from other countries as well, from France, Spain, Italy, and Great Britain and others. But we did not ask these PIs from these trials so far because we wanted to propose what we want to do first here in this meeting. So and now the scientific part, the molecular part, what we want to do, and I already mentioned the clonal dynamics in CML. We know that additional cytogenetic aberrations have prognostic impact. We know the impact of pH negative clones. That means outside of the BCR-ABL positive cells, we see molecular aberrations. And we know that BCR-ABL may be acquired and produce CML in patients who have already CHIPs. That means the older population with A6L1 or DNMT3A in the hematopoiesis, which acquires BCR-ABL, but we don't know whether this is by accident or whether this has a system, and we need to establish this with more patients. We have a clonal selection of BCR-ABL1 mutations that's already known, but we know a new site now for the new drug, which is now available, the asciminib, which has an allosteric binding site. And on this allosteric binding sites, we have new mutations which were not known before. And therefore, we need to sequence 2 different sites. And I already mentioned the persistence of BCR-ABL positive cells in deep or complete molecular remission. And it's of interest to check these specific cells on a single cell level for additional molecular aberrations. So this is an example here. This is a summary which has been published by Sue Brantford as a result of an international collaboration, just a collection of different sequencing data. You see that we see additional chromosomal aberrations at diagnosis in red, mainly A6L1, but also DNMT3A or RUNX. We see BCR-ABL kinase mutations in accelerated phase and blast crisis very frequently. And we see also additional aberrations in accelerated phase and blast crisis in blue. That means that's frequent. This is not unusual, but has not been collected systematically so far. One of the smaller examples, but I think a rather interesting example, is the external induction of such aberrations. And one example was the Chernobyl disaster, and we had the chance in collaboration with our colleagues in the Ukraine, with Irina Diagil, to sequence 20 CML patients who were in contact with the Chernobyl disaster, either living in the environment or working in the plant. And 13 of these 20, that means a higher proportion than usual, had additional molecular aberrations, 7 of those showing more than 1 mutations. That means we know that external environmental factors may induce such additional clones as well. So, and we summarized our proposal, what we want to do in this paper, which has been published in Leukemia last year by Sue Brantford and colleagues. And we created within the International CML Foundation a sequencing group, and we were still thinking about the way to bring this data together. But since you announced Harmony Plus last year, this has been not delayed, it has been postponed until now, because of course all these groups here on the top left, the European Leukemia Network Package 4, the UTOS Data Center in Munich, and the UTOS sequencing labs, and all the labs in the international CML foundations are interested to contribute sequencing data with clinical annotations of these patients. And it would be nice to have all these groups and individual labs here connected to Harmony Plus. So this is a roadmap. We want to transfer the registry data, which I mentioned, to have the clinical background from more than 6,000 patients. We want to complete new registry, like the blast crisis registry, for instance. And we want, that's the main part of this, our project, to collect annotated sequencing data within BCR-ABL and outside of BCR-ABL, and of course correlate this clinical data with the outcome. And if all these people who expressed interest will participate in this trial, we will, in a short period of time, collect a lot of data here. And I think it's very nice that Harmony Plus has now offered the chance to include CML, which is a BCR-ABL driven disease, but all which is outside of BCR-ABL might be even more interesting than BCR-ABL itself. Thank you very much.
Yeah, thank you very much for a very nice project that fits perfectly in Harmony Plus, and that we already have such outstanding data collections available that can go into Harmony Plus will definitely make the CML project a success. Yeah. So I think while I would love to ask many questions, unfortunately the time is almost over. And with that, I think I will hand over again to Jesus. And thanks again, Andreas, for this project. And I'm looking forward to hear more about it in the next meetings.